Welcome to the Deep Dive. We're here to sift through complex information and, well, basically give you the key takeaways so you're up to speed. Today, we're diving deep into something huge, young people's mental health. And look, the World Health Organization tells us over 1 billion people globally face mental health challenges. But focusing on England, the picture gets really urgent. In 2023, about 1 in 5 young people likely had a mental disorder. That's not just data, right? It feels like a silent crisis affecting communities, affecting the future. So our mission today, to really get into this landscape, we'll look at the challenges, but also the hopeful stuff like emotional intelligence, integrated support. And crucially, we need to talk about the systemic barriers, the things often left unsaid, particularly for young people from Black, Asian, and mixed heritage backgrounds.
Exactly. And we got some great sources to help us do that. We're pulling from NHS England, the WHO, of course, but also some really interesting academic work by Dr. Shungu H, her research on emotional intelligence, and her 6 stages framework. Plus, a key gov.uk report on race and safeguarding details on education mental health practitioners, EMHPs, and how King's College London is actually using Dr. Magads's framework.
Right. The goal here is to give you a really solid understanding, maybe spark some aha moments and, offer insights you can actually use to feel informed, maybe empowered.
Yeah.
Okay, let's get into it then. So let's start with the scale of this in England. That NHS data from 2023, it paints a pretty stark picture for young people, doesn't it?
It really does. It confirms just how widespread this is. For 8 to 16-year-olds, it was 20.3% with a probable mental disorder. Then it goes up for 17 to 19-year-olds, 23.3%. And it stays high for 20 to 25s at 21.7%. So you see, it's consistently high across those really critical years. It's not just a blip.
And it's not just a general rise either. Some specific issues, like eating disorders,
Yeah.
have seen just shocking increases. What's going on there?
Yeah, the eating disorder numbers are, well, they're quite alarming. For 17 to 19-year-olds, the rate went from 0.8% in 2017 up to 12.5% in 2023. It's a massive jump. And even for the younger group, 11 to 16, it went from 0.5% to 2.6%. And within that group, it's hitting girls much harder, 4.3% compared to 1.0% for boys, 4 times higher. It suggests, a really complex mix of pressures, maybe body image stuff, social media, underlying anxiety hitting young people differently.
Wow. Okay, so those English figures are pretty sobering. Is this just a UK thing, or are we seeing this reflected globally? The WHO findings. Yeah, they suggest something bigger, right?
Oh, absolutely. The global picture confirms this isn't isolated. Over 1 billion people worldwide living with mental health conditions. And women, overall, are more affected. But here's the paradox. The kind of silent crisis part investment just hasn't kept pace. On average, countries put only about 2% of their health budgets into mental health. 2%. So you've got this huge global issue, but the resources allocated are tiny in comparison. It means we're constantly firefighting, not really investing in prevention.
That is a critical mismatch. So if it's this widespread, what are the main drivers behind this crisis for young people? What's feeding into it?
Well, there are several big factors converging. The pandemic, definitely. Increased isolation, disrupted routines, changed access to help. Then you've got socioeconomic pressures, cost of living, poverty, housing, even access to good food. Huge stressors. And the online world, we can't ignore that. Harmful content, cyberbullying, those unrealistic standards. Also, maybe less obvious, things like reduced autonomy, fewer chances for independent play, community stuff. And all this piles onto services, creating record demand, straining the NHS, which ironically makes it harder to develop those early preventative programs because everyone's just dealing with the immediate crisis. It's a cycle.
It really does sound like a perfect storm. Okay, so if the problems are that complex, where do we find hope? Where are the solutions? Our research pointed towards some maybe surprising areas like empathy.
Yeah, empathy education is a fascinating example. Look at Denmark. Since 1993, they've had mandatory weekly empathy classes for kids aged 6 to 16. And the results? Consistently low bullying rates, high student well-being. Research suggests teaching empathy can cut aggression by up to half, boost cooperation. It shows empathy isn't just, a soft skill, it's teachable and has a real impact.
That Danish example is powerful. Makes you wonder why it's not everywhere. And building on that, there's emotional intelligence, EI. That term seems to be popping up more.
It is, and Dr. Shungu Magads's work defines it really clearly. It's about managing your own emotions effectively, which is crucial for handling stress, making good decisions, problem solving, fundamental life skills.
Yeah.
And Daniel Goleman's point that EI is often a better predictor of life success than, say, IQ, that's really stuck.
Absolutely. It frames EI as foundational. And the key thing here, unlike maybe traditional IQ, is that EI isn't fixed, right? It can be developed.
Exactly. That malleability is crucial. And policymakers in the UK have noticed initiatives like the Children's Plan, the SEAL program, Social and emotional aspects of learning, they're trying to bring these social and emotional skills into schools more formally. It's a definite shift.
Okay, so EI is vital, it's teachable. But training people, like educational psychologists, to actually use it effectively isn't always straightforward. Dr. Magadz's research found some hurdles.
Yes, her research with EPs was really revealing. She found quite a bit of conceptual confusion, like difficulty grasping different EI models, sometimes mixing EI up with personality traits. Some preferred the term emotional literacy because it sounds more learnable. There were also concerns about, the scientific backing, the measurement of EI. EPs want evidence-based tools. And many reported having very little specific EI training, maybe just a one-off session. Often the training they did get used what are called mixed models, which blend EI with personality rather than the more skill-focused ability models, so they felt unprepared. And that difference matters. Ability models focus on skills you can teach and measure, which is much more useful for intervention than models that blur EI with fixed personality stuff.
That distinction between models makes a lot of sense for practical training. Okay, so how are we trying to build better support systems on the ground? The education mental health practitioners, the EMHPs, seem key here.
They really are. EMHPs are a newer role, designed to work right in schools and colleges. They deliver evidence-based early help for young people with mild to moderate issues, think anxiety, low mood. It's a government-funded course. They're employed by NHS mental health support teams, usually band 4 or 5. And they learn to offer things like guided self-help and also help the whole school improve its approach to mental well-being. It's about bringing support closer.
And this isn't a small pilot project, is it? The scale is quite ambitious. What are we learning as these teams roll out?
It's a major initiative. Right now, there are 398 mental health support teams, MHSTs, covering about 35% of pupils, and there are another 200 teams currently in training. The aim is to get over 50% coverage by spring 2025. The idea is they bridge the gap between schools and specialist mental health services, focusing on prevention and early help. The big success, I think, is embedding this support right there in the education setting. Makes it easier to access, less stigma, hopefully catching things earlier.
That embedded support sounds crucial. And speaking of innovative approaches, Dr. Shungu Magadz's 6 stages framework, the SSF, sounds really interesting. What exactly is that?
Yeah, the SSF is a powerful model. It's psychologically grounded, developed by Dr. Magadza and inclusion psychologists, LTD. Essentially, it gives individuals and organizations a structured way to understand and navigate issues like diversity, equity, inclusion, but also to tackle bias, racism, discrimination. It provides a clear path from just understanding these things to actually making changes.
And King's College London is involved with this framework. How does that connection work?
That's right. King's College London is embedding the SSF into their training for those EMHPs we just talked about. So just to be clear, the framework is Dr. Magadza's work, but KCL is integrating it into their curriculum. Dr. Magadza herself is training the KCL tutors, who then get a license to use the SSF toolkits with their EMHT students. It's specifically being used in modules focused on anti-discriminatory practice. So it's about equipping those future practitioners with very practical tools.
Okay, that integration makes sense. Now, this brings us to a really tough but vital area, the impact of race and racism on safeguarding young people. We looked at that gov.uk report.
Yes, race, racism, and safeguarding children, and its findings were, frankly, stark. It found what it called a prevailing and powerful silence about race and racism in safeguarding reviews. This was based on looking at 53 reviews involving young people from Black, Asian, and mixed heritage backgrounds. That silence, it's not neutral, it has damaging effects.
The prevailing and powerful silence. That phrase really lands heavily. Why is there such reluctance, it seems, to address racism directly in these reviews, even when families raise it?
Well, the report found that none of the 53 reviews actually named or investigated racism, whether interpersonal, institutional, or structural, even when families explicitly alleged it was a factor. There's this reticence, this hesitation to really confront it. And that directly blocks learning and prevents meaningful change in the system. It's almost like the fear of getting it wrong or being called racist becomes a bigger barrier than the need to understand how racism is actually harming a child, which of course ends up protecting the system rather than the child.
That's a really disturbing consequence of avoidance, and it manifests in specific biases, like adultification. Can you unpack that term for us? How does it play out?
Adultification is, it's a really damaging bias. It's where young people, especially Black children and young people, are seen as older, more knowing, more responsible, less like children than their white peers. This means they don't get the same level of protection or nurturing. Their vulnerability is just missed. The report gave a powerful example. A Black Caribbean boy repeatedly stopped and searched by police. He was viewed primarily as a potential threat, a cause of harm, even though he himself was experiencing violence. His need for safeguarding was basically ignored because he wasn't seen as a vulnerable child.
That's just awful. A complete failure to protect. It sounds like their actual needs become invisible somehow.
Exactly. That's the concept of invisibilization. The specific vulnerabilities of young people from minoritized groups just aren't seen or properly understood by the system. Yet at the same time, they can become hyper-visible if they're associated with any kind of perceived trouble or risk. It means practitioners might fail to grasp their lived reality or how things like ethnicity, gender, neurodiversity all intersect and shape their experience. The complexity gets lost.
So what does this mean for the practitioners trying to do the right thing in these difficult situations? What are their challenges and what needs to change fundamentally?
The report points to really challenges for practitioners. Maybe a lack of confidence talking about race and identity, uncertainty about how to apply an intersectional lens, that fear we mentioned of being seen as racist. So the crucial thing is that safeguarding partnerships the leadership need to actively create an environment where practitioners feel safe and skilled enough to talk about, recognize, and challenge racism and bias. This needs to happen at every level, from how reviews are commissioned right down to everyday interactions. Without that systemic shift, the support systems will keep failing some young people.
We've covered so much ground here, from the sheer scale of the mental health crisis among young people to solutions like boosting emotional intelligence, and then facing these really deep systemic issues like racism and safeguarding.
We really have. And it hammers home that this crisis is complex. It's driven by internal factors, yes, like emotional skills, but also massively by these external systemic problems. But we've also seen there are solutions being developed and implemented, things like empathy classes, better EI training, the EMHPs offering integrated support, and innovative tools like Dr. McGad's 6 stages framework being adopted by places like King's College London.
And I think what really stands out from this deep dive is that supporting young people's mental health effectively isn't just about individual coping skills. It absolutely requires us to tackle those systemic barriers head on. It demands a dual approach, doesn't it? Nurturing individual resilience and fighting for more equitable systems.
Couldn't agree more. So maybe the thought to leave you with is this. Given that silence around racism we talked about, and knowing how powerful something like emotional intelligence can be, what's one concrete thing you could do? Maybe lean into a difficult conversation, advocate for more inclusive practices where you are in your community, your workplace. How can we each play a part in making sure every young person's mental well-being isn't just an aspiration, but treated as the fundamental right it is?